Here we go, another edition of Sports Medicine Weekly on this Saturday morning. Thanks so much for being with us. I'm Steve Cashel, Chicago Bulls radio host, joined by my usual co-host, Dr. Brian Cole. He is the head team physician for the Chicago Bulls, co-team physician for the Chicago White Sox, sports medicine specialist, and orthopedic surgeon at Midwest Orthopaedics at Rush. Our producer is Shane Reardon. Coordinating producer is Teresa Ann Seeger. Dr. Cole, how are you?
I'm doing great this morning, Steve. Great to see you.
Good. First topic, we're going to get right into it. Chiropractors. I've always wanted to ask you, I think we've talked about it maybe on the air, maybe in the 9 years we've done this show about chiropractors. How do you feel about them being an orthopedic surgeon?
So as an orthopedic surgeon, I will tell you for the first 15 years of my practice, I knew very little about what a chiropractor did. I mean, the common perception is that it's an individual who's trained in some alternative techniques that involves manipulation, right? And hands-on techniques and so forth, and doesn't do surgery, doesn't do invasive procedures, things like that, but takes advantage of, ways to harness our body's ability to feel better by working with the musculoskeletal system and manipulation and so forth, right? So that was always my thing. But that was it. And then I actually had, so one of the primary care sports medicine physicians in our group, her husband's a chiropractor. And I had neck pain and numbness in my thumb and index finger. So obviously a little bit of arthritis in my neck, right? And I just thought it would go away like any individual, and I'm really busy, don't have a lot of time to deal with it. So I went to our physical therapist. I got a traction machine, and, I have a little bit of arthritis like every surgeon does because they're leaning over 18 hours a day.
Right.
And then I went, she's like, just go see my husband. And I went to him once, and he basically just laid me on the table, did not really manipulate my neck, didn't get an x-ray. We talked, and he basically made me feel comfortable extending my neck, tilting it backwards and shifting it in alignment, I guess. And I'm telling you, the next day my numbness was gone.
Really?
Okay? Now, look, I hear that from patients. I'm like, look, the timing was just right. It isn't what you think it is. But the bottom line is, at least it caught my attention, right? So I will tell you now. So I think for certain conditions now that I understand it's much better, I'm a big believer. You know me. I spend most of my day trying to keep people out of the operating room. First of all, I'm very busy, right? So it's too busy to get people on the schedule for surgery. So we always look for ways to keep them out. So through that kind of thing, you learn about alternative ways and skillful neglect, as we say, right?
Okay.
That doesn't mean to their detriment, but you figure out ways to keep people out of the operating room. You offer them alternatives, and chiropractic treatment is one of those things.
See, I always tell people that. I recommend Dr. Brian Cole, and they say, surgeons like to do surgery. And I say, Dr. Cole doesn't. He will do everything.
I do love doing surgery.
I know you love doing surgery.
I'm going to do it only as necessary.
People are going to think, as soon as I walk in the room, it's going to say, we need to do a surgical procedure.
Right.
But
I take great pride. I will tell you, I take great pride in the office and trying to help someone understand that, look, that you're not going to need surgery, even though they've often been told it. It's like those are the greatest visits ever.
Right. Well, you guys have made a big breakthrough at Midwest Orthopaedics at Rush by hiring your first chiropractic orthopedist, correct?
That's correct. Dr. Tom Lotus.
He's on the line with us. Let's bring on Dr. Tom Lotus. Talk a little bit about back pain sufferer, back to box jumps after orthopedic chiropractic care versus traditional chiropractic care. What do we mean by that? I always am fascinated by box jumps. How you doing, Doc?
All right. How are you doing, Steve?
Great.
Dr. Cole, how are you doing?
Great, Tom. Thanks for coming on this morning.
Yeah, so how are you different than a traditional chiropractor, being an orthopedic chiropractor?
Well, I like to explain it's really not much different than any other profession or even medical school, as Dr. Cole could tell you. We all graduate with a degree, and then we carry on and we specialize. So just like in medical school, you've got a general practitioner, primary care sports, general surgeon, ortho surgeon. In the chiro world, you could graduate with a chiropractic degree and practice general chiropractic medicine that way. Or like myself, I went on because I had an interest in orthopedics and went through an orthopedic diploma and a rehabilitation diploma.
So Tom, you specialize in something called the McKenzie method, and I've been familiar with it, but I'm sure our listeners have heard of it. Some of them have. Just tell me exactly what that is.
It's a very reliable clinical evaluation, and what our goal is we're in search to classify and or subgroup a condition. So we're looking to see how a condition behaves. And just like you explained, Dr. Cole, with your neck symptoms, seen that one chiropractor. You had symptoms down your arm. We're looking for a position or a load to put the spine or any joint in that takes the symptoms out of the periphery. So in your case, out of your arm, and bringing it back to the neck, and then hopefully seeking abolishment. So it's a subgrouping classification system.
I've always wanted to know because I have been to a chiropractor before. I had a real bad back in the 90s, bad back, and everyone's like, "How did you?" Because they knew me. I could hardly play golf. I was miserable, and it went away.
Let me guess. You were 20 pounds heavier then than you are now.
I wasn't that heavy, but yeah, I
that's
lost
often
some weight.
A very
I started,
common thing.
I started doing more abs. I don't know. I had sciatica. I had the whole thing.
Yeah,
it has gone away. I had an L4, L5. It was diagnosed. I had a couple of epidural shots.
Yeah.
As they call them, or I guess that's steroid
but
or cortisone.
What was your experience when you saw a chiropractor? How was it?
Good and bad. I went through the Palmer method. I want to ask
what is that,
Dr.
Tom,
Lotus.
do you know what that is?
You know what the Palmer method is?
I do. There's basically two forms of chiropractic out there. Unfortunately, in the past, the history of it's based off of philosophy. And that philosophy is, palpation of the spine or a joint and manipulate it. The problem I have with that is, number one, it's a philosophy and it's supposed to be considered a science. But number two is the reliability of palpation. So, and that's the beauty, and that was my big interest within the McKenzie world, the amount of research they have on the reliability of their assessment. So just like Dr. Cole says, he takes great pride in not having to operate on every single person. I take great pride in not having to have to manipulate somebody. If we could find a direction that the patient can move and do on their own and reduce the symptoms, the outcomes are great, and we promote self-efficacy, which is basically a patient taking charge of their condition and resolving it themselves.
Again, we're visiting with Dr. Thomas Lotus. He is with Midwest Orthopaedics at Rush, a board-certified chiropractic orthopedist, also sits on the board of directors. What I didn't like, Dr. Lotus and Dr. Cole, is my experience with the chiropractor was that it was, okay, we just did a adjustment on you. I want you back 3 more times this week. And then I know people that go now 3 times a week for the rest of their lives. And it's just like, when is it going to end? And these people go, well, if I don't go, I'm going to be miserable. And it's got to come to an end some way. So that's the only thing I didn't like.
Yeah, it is amazing how when someone's in a position of authority and they don't really understand it, that can happen. And I know Tom. I mean, he's, you can speak for yourself, but your practice is you intervene, you make it happen, and if they're not getting better, you might look for some alternative treatment or therapy.
Sure, it's exactly right, Dr. Cole. I don't use any passive modalities whatsoever. In fact, my outcomes are usually somewhere between 6 to 10 visits with a patient, get them out of pain, teach them why it happened, educate them on how to keep it away. And when we're dealing with the spine, I preach all the time about, we hear about oral hygiene. We need to be educated on spinal hygiene. It is, the number one global disability in the world. So we have to get on top of it, and we have to educate patients, and we have to teach them these different methods of keeping themselves out of pain and functional.
What are the most common conditions, Dr. Lotus, that you treat among athletes?
I see a lot of shoulder conditions. I see a lot of neck conditions, especially with overhead athletes. A lot of low back, knee. I spend a lot of my time working very closely with the primary care sports med docs, trying to differentiate is the symptoms, are they coming from the neck or are they coming from the extremity? And we've formed a great relationship that way. And it's kind of interesting, and some of the outcomes have been actually staggering in the first 4 months I've been there.
Fantastic. Dr. Lotus, appreciate you being with us here and joining us on Sports Medicine Weekly. I think it's great, Dr. Cole, that you guys have added a certified chiropractic orthopedist.
We're very proud to have Dr. Lotus as one of our partners.
That's great.
Thank you very much for having me.
Appreciate it. We're back with more as our coverage continues of sports medicine injuries. And next we're going to talk with a young gentleman. He's a high school athlete who is really inspirational story. So stay with us. More ahead. You're listening to Sports Medicine Weekly only on
670 The Score.